The COVID-19 pandemic was first reported in Kenya in March 2020. The health, economic and social impact of the disease hit Kenyans hard. And while the government through the Ministry of Health rolled out various measures to contain the fast-spreading disease, the war on the COVID pandemic could not be fought by government alone.
We had two main objectives, that is risk communication and community engagement, as well as WASH. The project really wanted to create awareness that there is COVID, ways of prevention at community level, at individual level, and there were so many activities that we were carrying out in this particular objective, making people aware through radio messaging.
Through a grant by USAID, World Relief Scope COVID project, an emergency response project was initiated to support COVID intervention activities in 3 counties of Turkana, Kajiado and Nakuru counties.
Since our work is to develop guidelines, we started working on a guide using the work that had been done by World Relief before. We came together and started working on a document that can be used in Kenya. We adopted what had been done, and that made our work easier. And World Relief continued to support us to sit together and develop those materials and print them and take them to the counties.
In Turkana County, which is largely dry, water and sanitation are a major challenge here. COVID-19 presented a particularly severe challenge to residents. High populations in churches and mosques, and the very nature of communion, especially mosques, presented a unique challenge in the fight against the disease.
Mahali kulikuwa na ugumu sana kwa COVID-19 ni kwa upande wa Waislamu. Ilikuwa ngumu. Unajua kanisa iko na viti ya kukalia. Mwingine anakaa hapa, mwingine anakaa hapo, mwingine anakaa huko. Lakini msikitini sio viti, ni mikeka. And closeness is recommended.
So tulikuwa tunaishi na wasiwasi. Ilikuwa ni kama kanisa imekufa. Hata mimi kama mchungaji ya kanisa nilikuwa nakaa tu ndani ya nyumba, hakuna kutembelea watu.
Peter Lomurkai, the Sub-County Medical Officer of Health, lauded the partnership of World Relief and the county government in health service delivery in the region, and most especially in the fight against COVID-19.
This is one of the sub-counties that was performing at about 3.4% in terms of COVID-19 performance. As at now, we are at 17.3% in terms of COVID-19 vaccine utilization. And most of these efforts, I want to acknowledge that World Relief has played a key role in helping the sub-county in terms of its performance.
Meet Kevin Mboro. Kevin is a resident of Nakuru County.
COVID-19 nilisikia kwa radio sana na nikachukua hatua, nikaenda mpaka kwa kituo cha hospitali hapa Getare, nikakuja nikapata chanjo yangu na nikasikia niko sawa.
Ellen Ngware, a health promotion officer working in Nakuru County, says the county's collaboration with World Relief in risk communication and community engagement has helped in mobilizing the community towards COVID-19 prevention, control and vaccination.
We were able to mobilize our community to have infection prevention towards COVID-19. This is in hand washing, in wearing of the masks, and keeping even the social distances in the places of work, in markets, and in all the social places.
With the country consistently recording low numbers of COVID-19 and an infection rate of under 4%, and with over 18 million vaccinations administered across the country so far, collaborative efforts by various actors can be hailed for Kenya's achievement in the fight against COVID-19.